Welcome, everybody. Thank you for joining us today. We're going to talk about disruption in women's health. I am joined today by some really incredible panelists who have dedicated their lives to women's health. I have Holly Sheffield here from Cooper Surgical. I have Marissa Fayer from Deep Look Medical, and Brian Murad from Caldera Medical. And we're going to talk today about some of the challenges that face the women's health industry. We're going to talk about some potential solutions and ways that we're going to continue to innovate in this space. And who better to do it than these incredible leaders? So some of you may know that women's health has been plagued with underrepresentation and underfunding for many years in R&D. We're going to talk about some of the investment challenges today. One of the things that I think is really interesting to note, and thank you, Holly, for sending some of this data, women weren't allowed to participate in clinical trials until the 1970s. Some of you may know this. And actually, it wasn't until 1993 that Congress passed a law that demanded women be part of clinical trials. And today, there are still only 30% of clinical trials today include women. So we have a lot of work to do, a lot of ground to make up. So why don't we start with some basics? Holly, tell us, what is women's health?
Thank you. So first, I would just say thank you to AdvaMed. When I looked at all the panels that are happening over these days, I was so excited to see the number of conversations that will happen around women's health. And I feel incredibly privileged to represent Cooper Surgical, to be here with these leaders. You know, I would even pull it up a level when you think about women's health, because women's health is humanity's health. We are half the population, we are the caregivers, and we are making the vast majority of healthcare decisions. MedTech has an incredible opportunity against the entire lifetime of a female body. Contraception, uterine health, breast health, fertility, baby, parenthood, menopause, close to my heart now. There is an incredible landscape for us to go after, and we're already having a big impact. There are millions of women who do not have to suffer in silence with abnormal uterine bleeding, with incontinence. These are things that hold us back from having our very best life. Also, when you look at the inequities in care, MedTech has an important role to play, in particular in mother and baby health, how we close that gap. So as you can tell, I am uber bullish on the role of MedTech within women's health, but I also am very humbled by the challenge that we face and by the need that is there for our patients.
Yeah. Okay, thank you. So I do want to, before we go any deeper into this important topic, I want to just spend a minute and have you sort of introduce the work that you're each doing at your organizations in this space. So Brian, do you want to start?
Sure. So Caldera Medical, we are now in our 21st year. This is my 30th year focused exclusively in women's health. And what Caldera Medical is all completely focused on women's pelvic health, women that have polyps or fibroids, and the removal of intrauterine fibroids, as well as women who have pelvic organ prolapse or stress incontinence. So that's where we're currently focused, both from first-line treatments all the way to surgical treatments.
So Deep Look Medical is an imaging technology company, and we have our first flagship product, which is called DL Precise, which is FDA cleared. Yay. One of the few tech companies and AI companies that have like an actual solution that can be implemented immediately, so it's exciting. And so we focus on measurement, segmentation, and visualization of soft tumor lesions, any part of the body in any imaging modality. What we're very specific on is we can see inside dense tissue, very specifically dense breasts, which affects 40 to 50% of the population. Also disproportionately affects women of color, Asian women, and Jewish women. So it is also an equity issue. And we're making sure that the existing technologies that are out there, they have an augment to better visualize and to hopefully eliminate all the ridiculous anxieties that happen when you don't know what's happening in your body and you're getting called back, or you have to go for a biopsy, which 98% of them are unnecessary. And that's just in breast health, so very much in women's health. And I've been in like you. I've been in women's health for over 20 years, spent 9 of them at Hologic developing the 3D mammography system. So, breasts are our life over here.
And, Cooper Surgical, so also 30-plus year history, proudly serving women's health. We go across the care setting, so we are in the office, we're in hospital, we're in labor and delivery. We are also in fertility clinics around the world. Very proud of what we're contributing to advanced care, both through our own internal innovation as well as acquisition. So please keep investing in those innovative technologies. We are a buyer. We are also there with early stage capital. One of the things I'm particularly proud of that we have gotten the confidence with our lawyers to say is that a baby is born every minute with a Cooper Surgical product.
That's impressive. I actually got to see Steve McMillan talk earlier, and he said he wanted to be here, but he couldn't be. So, we should be honored. All right, so let's talk about one of the most, I would say, public challenges in this space is the lack of investment. So, despite the fact that analysts estimate this is a $1 trillion market by 2027, it still only represents 4% of U.S. R&D spending today, and if you take away oncology, it's actually only 1%. So for some reason, we're not getting the money infused to this market that we need. So Holly, what do you think is maybe the reason for the resistance to invest in this space? Or let's talk about that.
Well, I think the reality for investors is that success begets success. And so if we really look at the landscape, a lot of the earlier stage companies where people have put capital to work, there haven't been those back-to-back successful offerings. So it's hard for somebody who is maybe looking at the medtech space to say, yeah, it's a $1 trillion opportunity, but what do I have to hang my hat on that says that there have been successful exits? So, it's up to us on the stage and the larger medtech companies to create those successful exits, to grow companies to the point that we can have that healthy ecosystem. I think I feel like the wind is a bit at our back. We've seen some really nice successful exits. I can say the investments that we've done in my tenure of being the president of Cooper Surgical have all outperformed their acquisition cases. So I think we're happy to share that with any of the investors that you may have thinking about your companies. And I think that open dialogue is really helpful so that investors can hear from potential owners about what we're looking at so they've got that confidence when they put their money to work.
Well, Holly, I'm going to call you because some of our investors need a little bit more confidence. So I can say, Deep Look, we're not as established as a company, and we're relatively new. So, and we're raising our seed round. We're commercializing now, so we're pretty late raising our seed rounds, but it is, it's the funding landscape and going into an A round. But I think one of the problems is really that 90 to 95% of all investors are men. And it's not a bashing of men. It's to say, men, do you know about breasts? Do you know about uteruses? Are you interested? And most of the time it's no. And a lot of people used to be very cringy until the last few years talking about it. And it's not a cringy area. We're 50, actually, I think it's 51% of the population. And, it's a massive opportunity. And so when it's men who are controlling the capital, the problem is they're just not interested in that, nor is it like their friends that are bringing these opportunities to them from the golf course or from the club or whatever. And women and women's health, the investment in women's health is growing dramatically, way past actually some of the other verticals, which is fabulous to hear. But, we're growing from 0 to 1 to 2 to 2.5. So it's not like we're growing at a massive rate. So yes, we're growing and it's always continuously getting better, but it's because there's a lot more women who are in positions to make decisions on capital. There's a lot more funds that are being spun out that are specifically women and women's health and investing in women. And Holly, you said it as well. When you invest in women and women in leadership, most of those returns outperform. And it is true, and there's so much data now to back that up. So finally there's data. But when you start asking about, well, what are the exits? What does this look like? Okay, well, it's a pretty early nascent industry, And you're not going to have them, the same ones that you have that are in this room, in other industries. And so I think like that's one of the other areas that we have to be cognizant of is a lot of times as women's health companies, we have to educate what this opportunity is, educate what the market is, and educate as opposed to, I don't know, when you're talking about prostates, you don't have to educate.
Yeah, and what I would add to that is, as you're thinking about maybe where do you want to innovate, don't necessarily be a follower where there's already 20 companies or 50 companies. I think the stat is there's something like 1,500 new women's health companies have been established in the last few years, which is fantastic. That's a lot more than used to happen. But you see large clusters of companies going after the same problem, right? So you're chasing the same investment dollar for the same problem. So one thought might be, how do you look to be unique and to chase an area that you might be able to own yourself or be first to market yourself? Something that all of us think about when we look at our market opportunities, you know, the number of women that are aware of the solutions that exist is so terrible that we need you guys to figure out how do we get patient awareness. So when you're thinking of investment opportunities, think about the conditions that affect high numbers of women that have low adoption of solutions and be a bridge with patient awareness. I think all of us would be very interested buyers of something that can bridge that gap so that more women would know what solutions are available.
And maybe just to go back on some of my comments and to riff a little bit off from that awareness and access point, you know, as I was thinking in my head, I'm like, it's really not, the bar isn't so high. It's not every single one of our assets. It's outperformed. It's that total portfolio as we look at it, and we feel really comfortable with how that portfolio is coming together and how it's performing. And that's important because the cost of reaching women is very high. You know, if you look at creating access for 51%, or awareness for 51% of the population, that's a significant investment in advertising and marketing. When you look at reaching 20,000 plus GYNs in there, or the number of in their office space, or the number of hospitals just in the US, that's a really big investment in a sales force. So we're collectively making those investments. Don't feel as companies or as investors, you've got to hit that home run on everything. For us, it's that collective portfolio that we're looking at that performance on.
Yeah, that's a great point. As you think about increases in investments in R&D over the next decade, where are kind of the hot spots, or you know, if we're going to take advantage of opportunities that maybe are underserved in this space, what would you say, Brian, is a focus area?
So I think earlier in the patient journey, we've done a tremendous amount of mapping of the women's patient journey. It's pretty sad how many physicians or practitioners a woman needs to see before they typically get to the right one. So part of that is the earlier we can develop technologies or awareness or digital therapeutics, things that can make that patient journey earlier so that they can get to the right practitioner earlier, fewer women will get frustrated and drop out of the process. So on average, it takes 7 physician visits for a woman to get to the right practitioner. We have to do better as an industry sector.
Yeah, so there's a few areas that I think, and 7 is an astronomical number. I think we need to, like, there's tons of apps out there, so we probably don't need more. And, you know, maybe we need some that are very specific that nobody's actually looked at before. So when you're thinking about it, try to find, like, the niche of what you actually want to work on. I think another really big section is menopause. Finally, people are talking about it, and I'm happy, thankfully, at my age, that finally people are starting to talk about it. That, like, it affects, and it's not a disease, it's literally a life cycle, and it affects 100% of these 51% of the population. So you can't stop it. You can't, I mean, I hope we can postpone it, but it's going to happen, and it affects women in the workforce. It affects how we function. It is a massive problem, and it's not just like a problem and one thing happens. Every woman's different, and every symptom's different, and how you deal with it is different. There needs to be a lot of solutions and opportunities for innovation in that space. So I'm really, really excited, hopefully, about some of the things that are coming out with menopause. I think the other side, when we talk about women's health and we talk about the 7 doctors that it takes them to get to the right one, how about we eliminate that or make it to like 3 or 4 or maybe 1? I mean, let's be aspirational here, but maybe 1 doctor, and maybe that doctor, she has all of the information she might actually need to help her patient to make it easier. Women are busy, and not to say men, you're not busy, but women disproportionately have a lot of the homework as well that they need to take care of, and the family and the children and all of these things. So women are busy. Let's not make them go to 7 doctors, because I'm sure 70% of them are not going to figure out how to get to that 7th doctor. I mean, I think 70% was nice, but very generous. But I think let's make it easy for the physicians to have the information that they need so that they can do it, and they can get the woman to the right person and the right specialist. So those are the things that I'm actually excited about. I don't have a solution. I'm just saying, I'm excited that there might be solutions in the audience.
Yeah, and I would add to those great comments just by encouraging folks to say, what are those proven technologies? We're talking about disrupting women's health. Interestingly, within women's health, you can take proven technologies from other sectors, apply them to that life cycle of the female, and have a true impact in an innovative product. So you've got a lower risk. You're just going after an indication that hasn't been on people's minds, and now it really is.
And think through, just a last comment on it, when we talk about disruption, like you were saying, I mean, only 10 years ago, hips for women were generated? I mean, the fact that they were putting in men's hips and women's, I mean, we're just naturally, genetically, biologically smaller. And the thought that, we should innovate for a woman's body too, like you're saying, there's so many innovations out there already at your companies or other companies. Think about how that can be applied maybe to a woman and a woman's body.
Yeah, great point. So we're going to pivot a little bit, as we expected. We have far too many questions for the time we're allotted. So we're going to pivot a little bit to think about deployment. So as we think about innovation and reaching women around the world and really providing solutions not only in kind of primary markets but in the rest of the world, let's talk about some of the experiences you've had in doing that, because there are some complexities there. Yeah.
And hopefully you can tell I'm going to take a glass half full approach, because that's a bit on brand for me. We've been really encouraged when we look at the global opportunity. Just to give a real-world lived experience, in India, cervical cancer, a huge challenge. And the clinical community, the government payer environment, very, very engaged with us in terms of how together we can raise awareness so there's more screening. And then how do we sell colposcopes for the women in the audience? I apologize. For the men, never wish it on yourself. But they are highly, highly effective, and they're a low-cost first-line treatment, and it's capital equipment. It works in that environment for the number of patients that they need to serve. So there's an opportunity to grow, to increase access, and to be positively engaged with both the clinical community and the government payers.
Yeah, I don't know
who's going next. I would say we need to talk through a little bit of the regulatory clearances. So while it's, we need to get US FDA, you also have to get CE, it's really long. In a lot of developing countries, they take US FDA, which is great news, and there could be a justification. So that's one hurdle we need to get around in emerging markets and developing countries. I think also a lot of education. So I'm sure, Holly, you guys do a lot of education on why this technology is important, the right one to be using. And so that's the other thing. And there are so many brilliant and smart doctors and clinicians and nurses in every emerging market and developing country. And we need to bring doctors to train them, and then we need to leave them with the equipment so that they can do their jobs. And that's where it's lacking. And unfortunately, a lot of it has to be done first on a nonprofit level and then eventually on a for-profit level, because you need to prove to the ministries of health who are going to purchase all of these that it's necessary and it's working and this is the right equipment. And for companies, that's a really big cost and a risk that you sometimes have to take. But and I know you do a lot of that work. Like you have to take that risk and that work, and you have to just be really patient, because I think something like 75 to 80% of the growth in the population is going to be happening in the developing worlds and emerging markets, and every single one of those people, especially women, need health care, and they need access to health care and the correct health care, and it's not the same as what we necessarily would have here. Most of the time it's actually far more innovative, which is exciting. So,
Yeah, and for us, we've taken the focus approach. So we're in about 20 countries outside the US. The regulatory landscape certainly dictates some of that, but reimbursement for what we do is also widely varying. And so we know we can't be everything to everyone in all markets around the world. So we very much have a focus mentality of where we're going to enter a market, make sure we have the right plan, we have the right resources, we have the right investment, we have the willingness and desire for those countries to actually support the technology that we have. And so we're not trying to be everywhere. On the humanitarian side, we've done work in 85 countries, so we're certainly willing to explore and be helpful on the humanitarian side rather than just the commercial side. But for us, part of our success is recognizing what we can do and how we can do it and do it effectively rather than be mediocre at doing a whole bunch of things.
Okay, good. Thinking about overcoming some of the challenges in global access and reaching women in some of the countries that with highly inaccessible communities or large growth in populations. One of the things that is exciting is how AI, ML, or 3D printing, or sensors, or these advanced technologies are going to impact women's health. I'd love to hear from each of you how you think the innovation around those things is impacting women's health and how you approach the market.
I definitely take an all the above approach. If we can find internal efficiencies using AI technologies that enables us to do more and to reach more patients, if we can bring those technologies to the products we currently offer, that just lowers, in many cases, the cost of care, which is fantastic. It enables a procedure to be performed perhaps in an environment that's not a hospital environment or by a clinician that's not a board certified, triple lettered board, type of clinician. So ultimately there's a patient benefit, there's an access benefit, and so we look at where we can take what we currently have, up-level that. And then as we move forward, and we talked a little bit about it at the lunch session, there will be truly new products that start with that at its core. But we don't have to run to that endpoint right now to have an incredible impact.
Yeah, and what I would say is big data has been a game changer. We just acquired a company, Atlantic Therapeutics, last month that has the only wearable technology for neuromuscular stimulation. And without having access to big data, that technology would not be as on the forefront of where we would look to invest as it was, let's say, 5 years ago. And so for us to be able to take some of the big data, know how to target access to patients, has enabled a whole new channel for us, which is direct to consumer. We've always been a surgeon-only focused model, but now with AI and big data, it really allows us to have the confidence that we'll be able to scale in a pretty significant way a direct to consumer product and get the product in the hands of millions and millions of women on a much more rapid scale than hiring more sales reps and more marketing people in the field. It kind of bypasses that from an investment standpoint. So harnessing AI, big data is something that we're very keen on.
So as a software company that's playing in the AI space, obviously I'm super excited about it. So I would say it is a way to first help the clinicians, the radiologists, the oncologists, workflow. Make things easier for them so that they can spend their time on the more complicated issues. But one thing that we very much at Deep Look believe in is you need to start with the facts and the truth. And that means deterministic software that is fixed and it's not changing and not learning over time. That has to be the base. That also allows the physicians to have confidence. Like the question that came up before, obviously Ginny was talking about it in the lunch. Like, you need to understand where the data is coming from, where it's learned from, et cetera. If it's fixed fact, like code that we've been using for 20 years in all of our other technologies, that's great. Then you can learn on top of that, as opposed to feeding it information that you don't know where it comes from. You don't know if it's good. You don't know if it's based on fact. You don't know, what the details are. And when it comes to AI and eventually machine learning, we have to educate everybody on what that is, what's next, how, give them the information that they're asking for. Because as much as we think that AI has been around for a while, it's pretty new in everyone's new lexicon. There's a really big difference between AI and what we've been doing for many years and machine learning, which is relatively new, especially when it comes to the hands of the physicians. They still, and I think we all feel the same way, we want them to make the decisions. We want them to still be the doctors. They need information, and this is AI is a way to help them get the information faster, easier, better, with more information so that they can get you to the next step easier.
Yeah, we could do this all day. We have a lot of things to talk about, but we do have to start wrapping soon. So I want to do kind of an around the horn here. I know a lot of people are learning about women's health in this audience, and there are probably a lot of people who are looking to build businesses and invest in this space. So if you want to leave sort of one final thought or theme for people to leave here and remember, what would that be?
Just do it.
Well, that was concise. Okay.
Ditto. But
Menopause.
so yeah, menopause, breasts, vagina, just say them every day, all day long, it's fine. They're not taboo subjects, we all have them. What I would say, it's a phrase, and I don't know who said it, and if I remember who did, I'm going to thank them for it. We need to focus not on women's health, but the health of women. And that one, and I've been in women's health for 20 years, that one stuck with me and was like a slap in the face. So to say it again, don't focus on women's health, focus on the health of women.
That's good. One thing that I was talking with a women's health CEO over the weekend who's looking to raise capital, and as many of you know, not the easiest time to raise capital. And she was trying to pick my brain. And I said, well, who are you reaching out to? She said, oh, all the investors I've been talking to are all CPG companies, CPG funds. And I thought, oh, that wouldn't even occur to me to recommend that you talk to CPG funds. Have you reached out to any of the women's health specific funds looking to invest in technology companies? You're a technology company. She said, no, I didn't even know they existed. So just know who your audience is and who you could go to at the various stages. If you're seed companies and you're a women's health company, go to women's health funds. Go to us as strategics. We're looking to acquire businesses. I probably spend 65% of my time on M&A activity. Holly and Cooper Surgical are one of the companies that do more acquiring of women's health companies than anyone else. Talk to the strategics, but know who you're talking to and just network around. We need the industry to be successful.
Well, thank you so much. We have 15 seconds to spare, so well done. Thank you all so much for participating today, and thank you to the panelists for a great discussion and to AdvaMed for hosting the conversation.